Hello, how are you all? This is AMC Part 1 recall from the Gynae section and hope this will clear your confusion. So let's start without delay. A 25-year-old female present with pain and swelling of her vulva. She has been experiencing discomfort during sexual intercourse and while walking for the past few days. She denies any past history of sexually transmitted infection. Her partner is asymptomatic. She is afebrile and generally well. On pelvic examination, a red hot swelling is noted in the posterior end of the labia majora. Speculum examination reveals normal appearing mucosa without significant discharge, and there is no regional lymphadenopathy. Which one of the following is the most appropriate initial treatment? First of all, let's discuss what's the diagnosis actually. So, there is a swelling hot red swelling is noted in the posterior end of the labia majora. So, this is the anatomical location of the Bartholin gland, and always when the patient is having Bartholin gland abscess, this is the common complaint. She will experience discomfort during sexual intercourse as well as while walking. This is the most common symptoms when a patient having a Bartholin abscess. So this is a clear-cut case of Bartholin abscess. Why abscess? Because this swelling is red and hot, and this look like the infected. So that's why this is Bartholin abscess. So let's start discussing the options. What is the most appropriate initial treatment? They are asking: A. Antibiotic, B. Marsupialization, C. Word catheter, D. Excision, E. Hot compress and analgesia. So we will not pick that hot compress and analgesia. This is the wrong. Why this is the wrong option? Because they are asking most appropriate initial treatment. So treatment of the Bartholin abscess is always some surgical option should be there. If they will ask you the most appropriate treatment, most appropriate initial treatment, this means they are asking you the first line surgical treatment here. So first line surgical treatment will not be the hot compressor and analgesia. Hot compressor and analgesia will be the answer where they will ask you the next line treatment, or they will ask you the conservative management. So in terms of conservative management or next line management will be the uh, hot compressor, analgesia and antibiotic. But they are asking here the most appropriate initial treatment, means they are asking us about the first line surgical management. So antibiotic is also not the good option because patient is afebrile, and they are asking here the first line surgical treatment, most appropriate initial treatment. So this is the statement. We should think about the most appropriate initial treatment is the surgical treatment, first line surgical treatment. So what is the first line surgical treatment of the Bartholin abscess? So the first line surgical treatment of the Bartholin abscess is word catheter. Why word catheter? Word catheter they have included nowadays in the current practice because this is outpatient department process. Word catheter we can insert in OPD, outpatient department, as well as in terms of anesthesia. This is the best choice because we can use the local anesthesia for the insertion of the word catheter. So this is the most appropriate first line surgical treatment. What is marsupialization and when we will use the marsupialization? Marsupialization is also not the good option because they are asking the appropriate initial treatment. So marsupialization, when we will choose the marsupialization, when patient is having the recurrence of Bartholin abscess and already this word catheter failed. In terms of the treatment, the failure, the patient will complain that already she tried the word catheter but it failed, and patient is having again and again recurrence of this Bartholin abscess. We will choose the marsupialization. Why? Because it needs general anesthesia. This surgical management needs general anesthesia. Patient is having a discomfort when we will perform this marsupialization. It should be performed in the general anesthesia. So that's why marsupialization will be the surgical management when patient is having the recurrence, and patient will complain that she having the word catheter management done and she failed, that again she having a complaint of bartholin abscess. So in that scenario we will choose the marsupialization. Excision is not the good option because nowadays it's not in the current practice because of its recurrence. So the correct answer is word catheter in terms of most appropriate initial treatment or most appropriate first line surgical treatment. So hope these options are clear now. Let's see the explanation as well. Correct answer is C, word catheter. The patient has sign and symptoms suggestive of Bartholin gland abscess, and management of Bartholin gland cyst is different from the Bartholin abscess. So I'll show you the word catheter. This is usually OPD or outpatient department process. It can be placed in under local anesthesia. Patient have to come for follow-up after 4 to 6 weeks, and this catheter placed in the Bartholin abscess incise, and the catheter placed inside by filling with the balloon with a 2 to 3 ml normal saline and left in for 4 to 6 weeks. This is a very good treatment.